So PCG, our Prospective Clinico-Genomic trial, which, as you mentioned, we're presenting an abstract at ASCO talking about it. It's a platform that's being built in collaboration between Flatiron Medicine, Roche Genentech, and Foundation Medicine. And it's really trying to tackle two problems. The first, the scientific question, is looking at circulating tumor DNA. So the ability to look at markers in a cancer's genomic profile and try to understand how we can use that information for better understanding when patients are responding to therapy and when they're not responding to therapy, and also starting to explore some mechanisms of resistance. So trying to understand why certain patients don't respond to certain therapies. So there's a really interesting exploratory scientific question here. But in a lot of ways, the sort of core of this is it's as a pilot or a feasibility study that's tackling an even broader problem. And that is, how do we make clinical trials easier, more seamless, more efficient as we're executing them? This has sort of been a chronic problem, is clinical trials are often seen as burdensome. It's hard to get patients on clinical trials. The data collection part of this is very burdensome. So one of the really novel things that we've done here is sort of transformed the paradigm of how we think about data collection in this trial. And we're using what's called technology-enabled abstraction to pull out almost all of the relevant clinical data points for this trial on the back end, and really sparing the clinics the time, the burden, and the work to go through these things. So we're really excited about the science behind this particular study, but I think what's even more exciting is the concept of building a platform that we can ultimately scale to lots of different types of trials. And how do you use technology to make the execution of clinical trials easier? Yeah, to a large extent, that's exactly right. There is a little bit of data collection. That's the responsibility of the practices, but it's quite minimal. If there are questions that come up, we will talk to the practices and ask them. But yes, the bulk of all of the data collection that typically is done manually in the practices, entered in what's called a case report form, then manually put into a separate electronic system. All of that is being done on the back end by Flatiron, leveraging technology that we've built. The bulk of the practices participating in this trial are community oncology practices that actually use OncoEMR, which is Flatiron's electronic health system. We do have limited exposure to other EHRs, and we do have technology that will enable that as well. But you're right, the more EHRs you get, the more complicated. So we're starting with a bulk in OncoEMR, but also some early work with other EHRs as well. And as I think you're pointing out, if this is ultimately going to be scalable, we want this to be able to work beyond just one electronic health record.